So my name is Kim Vopni, and my business is Pelvic Wellness, and I'm known as the fitness doula. So how that all came about was I started out as a regular mom and became pregnant and was wondering how I was going to get through the process without ending up like my mother did, who had episiotomy births. She had surgery in her 50s for her bladder. So I was really looking to avoid all of that. In terms of prenatal exercise, there's benefits similar to when you're not pregnant. There's obviously benefits to exercise that everybody knows. There's more specific information you need to pay attention to while you're pregnant. So it's important to visit somebody who has information about how to move properly, what heart rate you should be at. But even more specifically than that, there's pieces of information that are missing for women, specifically about pelvic floor health and diastasis recti, which is the abdominal separation that women complain about afterwards, the mummy tummy, and they don't necessarily know what's happening. So information like that isn't necessarily covered in regular gynecological visits in terms of prevention and therapeutic approaches to treating the mummy tummy and pelvic floor afterwards. Women have opportunities while they're pregnant to investigate approaches and treatments and practitioners that can help them prevent issues. So looking at perineal massage and how they may be able to perform better in birth in terms of their body positioning so that they're less likely to have tearing or require an episiotomy or have the interventions that can then lead to more serious complications from a pelvic floor perspective. And also from a mummy tummy perspective, there's information such as simple things like posture and the ways that you get up and down off of the floor, what exercises are safe or not safe, and some exercises that might contribute to getting mummy tummy. And that information isn't necessarily as readily available as it should be. Quick tips from a pregnancy perspective. So if you are currently expecting, first of all, congratulations, but if you would like to look at preventing pelvic floor dysfunction and mummy tummy, some quick tips would be to try to limit the amount of time that you're sitting. Sitting typically puts us into a posture that's not necessarily pelvic floor friendly and also therefore not core friendly or deep abdominal friendly. So you want to limit the amount of time that you're sitting. Ideally, if you can stand, or if you do have to sit, try to sit actually on your sit bones and on your perineum rather than having your pelvis tilted backwards so that you're sitting on your tailbone. Unfortunately, most car seats, most chairs that we sit in at the office, that they're all have sort of a backwards tilt that encourages that sitting on the tailbone phenomenon that we want to avoid. So you'd also want to avoid movements, forward flexion movements like sit-ups and crunches. If you're ever lying down on the floor, you would want to go down onto your side and then roll over onto your back. And if you're getting up from the floor, you would want to roll over onto your side and then stand up. And that avoids the forward flexion and the pressure that gets placed on the connective tissue in the abdomen that can encourage the muscles to separate even more. And from a postpartum perspective, so once you have had your babe, I do recommend you wear some sort of a support garment that helps keep the healing tissues supported and allow those separated muscles to reapproximate. But I do recommend that it's done in conjunction with restorative exercise. So a great person for that would be a pre-postnatal trained personal trainer as well as a pelvic floor physiotherapist. So perineal massage is a great tool in terms of promoting the elasticity of the tissues and encouraging women to learn how to yield against discomfort so that when it comes time to give birth and the baby's head is crowning, the woman is not tensing up around that pain, but is able to yield against that discomfort. And birth position, I think, is another topic that is widely missed in general conversation. So most people have watched TLC Baby Story and they've seen women giving birth lying on their back with their knees at their ears and somebody's counting to 10. And that really is one of the worst positions to give birth in and can cause more damage in tissues and more likely to have intervention. So having women explore other positions for birth that are more upright on all fours, squatting, side lying, those will be more preserving to the perineum and the pelvic floor and less likely to see the intervention.